information provided in this show is intended for educational and entertainment purposes only. Viewers should use their own discretion and consult with a healthcare professional for personalized guidance and recommendations. Hi, everyone, and welcome to the Health Revolution. We are so excited that you are here today with us. I'm your host, Adriana Morrison, and our show is all about engaging conversation, elevating health and wellness, and empowering transformation. Now, as you are tuning in, no matter where you're live streaming on in, remember that we have show notes at the very bottom of your screen, so you can always drop down and refer to the exciting information that we're sharing with you today. Because if you did not catch the live stream and you're catching this on on-demand replay, just know that we have some reference points that are going to be some incredible takeaways for today. And without further ado, I'm excited about today. This was a topic that I'll admit it wasn't something that I had that I had stumbled upon before, except for in recent conversations. And I think this will be an incredible way to just shed light on some things that are considered options for those who are really truly navigating their paths through some challenging times, some burnout times. And we're going to get into that and explain what this means. So my guest today, her name is Dr. Eliza Collins, and she is a psychedelic facilitator and burnout expert, professionally known as the Burnout Witch. So she works both one-on-one and with groups to help individuals get out of survival mode, optimize their health, and live with a greater sense of ease and flow. So she's got a combination in terms of her background with both Eastern and biomedicines. That includes psychedelic plant medicine, the functioning medicine, acupuncture, and Chinese herbal medicine, hypnosis, and a whole lot more to approach healing from a unique perspective that seeks to fully integrate the mind, body, and spirit. Now, we're going to tap into what this means because, of course, as we hear the term psychedelic, that might conjure up some unique opinions. And so this episode clearly allows us to have an opportunity to get granular, get specific, and of course, she's expert. So we're going to get a chance to tap into all of that. She's published articles on Medium, Thrive Global, and Bustle. And so without further ado, allow me to welcome Dr. Eliza Collins. How are you?
I'm great, Adriana. How are you?
I'm doing fantastic. I'm really excited about this because this is not in my wheelhouse. And so, of course, as we move better in society when we stop, lean in, and listen to the takeaway nuggets that allows us to think from a different perspective to then see the entire landscape with our health. So tell us a little bit more about you, how you became to be the Burnout Witch. And then, of course, we'll get into some of the legalities of all that applies with your practice.
Definitely. So my story starts a long time ago in a galaxy far, far away. In 1983, my biological mother passed away when I was 13 months old. So I'm a child of what we call big T trauma and pre-verbal trauma. So that happened at a time when I didn't have words to express myself. And trauma can happen, as we know, at any point in time along anybody's timeline, and it's always really impactful. For the way that showed up for me was I had an otherwise very well-adjusted childhood. So I didn't really understand my trauma, and it didn't come up in places mostly throughout my childhood. I was an anxious kid, but that's really about it. But ways that it showed up that I didn't realize were tendencies toward perfectionism and imposter syndrome and not enoughness, because that trauma of losing her, of having a primary caregiver go away at that age, made me feel like I needed to earn love and be worthy of love, in spite of the fact that my family did not communicate that to me. My family just loved me. They're wonderful. But that was still kind of programming that got coded into my brain. And so as a child and a teenager, that could be really useful, right? Because I was a very good student. I was a straight A student. I really loved music. I really loved dance. I excelled at those things. the amount of effort that I was putting in looks like ambition and hard work. And those are values, particularly in America and in the West, that we very highly value. Those are things that are lauded and that we look for in people. So those things really helped me throughout my childhood and young adult life. And as I got older and I started to go out into the world and I started to take on more responsibility, those tendencies made it harder to exist in the world. So I managed to get through my 20s and I got my degree in acupuncture and Eastern medicine. And then I opened my business and I'm a solo practitioner. And so I went into business for myself with no help as an acupuncturist, but also as the receptionist, as the insurance biller, as the web designer. And with these tendencies of perfectionism and not enoughness and overachieving hard work for a sense of self-worth, I burned out really badly because I wasn't running my business aligned with values that are good for me and that fill me up. I was running my business based on how other people told me to, and with this very shaky foundation of really poor coping mechanisms that helped me when I was young and totally broke down as I got older. So in 2019, an organization that I contracted with that referred a lot of patients to me did some internal restructuring. And for a period of time, they weren't referring out as much, not because anybody was doing anything wrong. They just kind of stopped referring out wholesale to all of their independent contractors. And they were about 50% of my business. And so my business was kind of gutted overnight. And I ended up having this panic moment of like, oh my God, what am I going to do? I've spent 5 years building this business and I could lose it at any time. So I reached out to a colleague of mine who had started very successful businesses, acupuncture practices in places where she didn't even speak the language. And I said, "How did you do this? Because you've clearly got the secret sauce and I really need help." And she said, "Oh, I burned out doing that. You're burned out. And we're going to help you with that." So working with her in combination with some of the other things that I had gotten through my background, like functional medicine and acupuncture and all of these other things, I addressed my burnout. And in 2020, 2021, that's when I started helping other people with that. And I've done a lot of therapy throughout my life. The burnout recovery was incredibly important, but that pre-verbal trauma was still in there. And I had gotten to a point where I had done a lot of healing and recognized that, I don't get panic attacks very often, but when I would have a panic attack, I could tell you in the middle of the panic attack physiologically what was happening in my body and the way that we would address it. But those techniques weren't landing for me. It was really hard for me to just kind of breathe my way down or use EFT tapping or some of the other techniques that we use to manage anxiety. And I really felt like it was rooted in that pre-verbal trauma because my brain and my body still weren't as connected as they could be. And I've worked with veterans for about 10 years in my acupuncture practice, and some of them had utilized psychedelic mushrooms for post-traumatic stress disorder, which is what I realized that I had had this whole time. It took me a long time to figure that out. So, having done a lot of therapy and already worked with and had a good understanding of my trauma, I found a psychedelic coach and I worked with him to prepare for a psychedelic experience. And I utilized that as a way to really get back into my body and create a somatic connection that wasn't there and that traditional methodologies had not given me.
And
And
this is
so,
this is huge. And I'll tell you, and there's a lot to unpack here because of course viewers are probably having a bunch of different questions. So
of course.
let's back up a little bit and talk a little bit about burnout, because when I first got exposed to the term, I just used it as a maybe as a matter of fact situation. Well, I'm feeling tired, I'm burnt out, I need to tap out, I need to take a moment and everything will be fine. So what's the difference between, say, if someone like me thinks burnout as in just an overused term, and what we've come to describe as burnout as a realistic situation where there are some challenging obstacles for that person?
That's a really great question because this is something that I feel like in the sort of burnout sphere, it's not always clarified. So when we talk about, your situation where you were saying, "Oh, I'm feeling really burned out. I just kind of need to tap out. I need to take a vacation and recharge my batteries or take a long weekend and reset and feel better after that." That's not the same kind of burnout. Like that's stress that you can manage. burnout is a state of sustained chronic stress that over time reduces our ability to handle day-to-day stressors with ease. So some of those day-to-day stressors that make you feel like, "Oh, I'm kind of overwhelmed. I just need to like put my phone on do not disturb, take a day for myself, recharge my batteries and go back into my life." With burnout, those types of responses, those types of sort of self-care responses that we hear about with burnout, like meditate, get more sleep, drink more water, those are not techniques that are useful for people in burnout because they have had a situation that has stressed them out for such a long time that that day-to-day stress becomes something that they also can't handle.
Now, is there a specific, are there parameters that define that clarity for what burnout truly is defined as? Is there a certain period, extended period of time? Is there a situational occurrence of a situation that defines it as an official burnout?
We don't have a medical diagnosis for burnout right now. So you can't go to your doctor's office, tell them what's been going on, and they'll say, okay, we've got this code in our manual of codes that is for burnout, and this is how we treat it. This is how we start to address it. So that's been one of the problems in addressing things like burnout is it's not a mental health diagnosis right now. And so you can go and your doctor can say, okay, you have anxiety, depression, a combination of anxiety and depression, bipolar disorder. Burnout is not in that. And so the medical community in general doesn't really have a framework for how to address it, which is why it can be really challenging for people who are in it and feeling like they don't have any resources.
And this is huge because then to at least to connect, to bridge the gap, there's some pitfalls in doing so. And what have you discovered on your personal journey to understanding burnout and then, delving into this professionally to help others? What have you discovered in your dialogues with others that maybe do represent the medical field or the medical community?
That's been really interesting because when burnout was first defined by Christina Maslach with the Maslach inventory, which she created, she was looking at healthcare professionals. So that was the area of her study where she was saying like, okay, these people are working really long hours. Some of the markers of burnout are a sense of apathy and disconnection with their patients and sense of overwhelm and not enoughness, that feeling of I'm not doing enough or I can't give enough or I'm not good enough. And so it's actually burnout kind of started in the medical field, but we don't have that sort of language for it right now in the medical field. And so what I've seen is a lot of naturopaths, osteopathic doctors, and even biomedical doctors who are starting to think outside the box in terms of the way we approach healthcare in general. They're really open to these conversations of the types of things that are useful for people in terms of not just kind of popping somebody on an antidepressant and leaving it at that. Antidepressants and medication can be hugely helpful for people, and I'm very supportive of that option for people. But when we leave it there and we don't address what's underneath it, that's where it can get kind of sticky.
And this is a really great conversation because now there is some uncharted waters that say society has yet to tap into. So how did you start using the dialogue to get what you need to take care of, say, the inner trauma that you've had and begin to heal in different areas of your life?
One of the places that I started was just working with my friend who is also a burnout coach. And she's kind of the one that pulled me into the burnout coaching area. And when we look at burnout recovery, which is different from burnout prevention, we have to start with much more small, digestible steps. So it's not, doing a whole 30 and cleansing your gut or making these really big changes. It's setting an alarm on your smartwatch or your Fitbit 3-4 times a day to breathe for 60 seconds. These are incredibly small and almost kind of silly when some people think about it, ways of approaching this. I had watched your episode about pee when you need to,
Yeah.
which I absolutely loved. That was a great episode.
On purpose.
Pee on purpose. And that's one of the things that we have people do is pay attention to your body. If your body is telling you that you need to go to the bathroom, don't sit at your desk for another 30 minutes and craft a bunch of emails. Go to the bathroom because that's your body telling you what it needs, and you going and doing that is listening to it and saying, I see you, I hear you, I'm going to show up for you. And that kind of connection, small, digestible ways over time, is what helps us understand when we're starting to feel overwhelmed. Because as we get into this sort of fight, flight, chronic stress, panic, we're just on autopilot, right? And so we don't know when we need to pee. We don't know when we're hungry. We don't know when we're thirsty. If we're tired, we're fatigued, we don't think about going and grabbing a glass of water. So these are the types of things that we start looking at with burnout recovery. And they were things that helped me immensely. One of the other things that helped me was, she said, don't show up at 150% in every area of your life all the time. Figure out where you're putting your energy, put in as much as you need to get the most out of it, but don't put more than that, because you're just exhausting yourself. So these are the types of conversations that we have with people when they're starting their burnout recovery journey.
This is really good, because this, I certainly don't recommend killing a mosquito with a shotgun, but but you're absolutely right. And that showing up with that intentionality, I could see how this reveals more of the facets of the definition. You mentioned something that intrigued me just now. You talked about there's a difference between burnout prevention and burnout recovery. Can you talk a little bit about that?
Absolutely. So a lot of times when we read articles or see things online about, you Google burnout and people say, okay, here's a list of things that can help prevent burnout: meditation, getting enough sleep, eating a clean-ish diet, getting regular movement. For people who are in burnout, they may have digestive issues that make it hard for them to digest healthier foods like roughage. They may have leaky gut that results in brain fog, or an inability to get nutrients. And so they may be more fatigued. A lot of these things that require energy or focus, meditation is a great one. Burnt out brains actually shrink, which sounds really scary. They can grow back. But with that reduced gray matter and that reduced connection between the left and right hemispheres, the kind of communication that we need for effective meditation, it makes it really hard to meditate, because burnt out people can't focus that much. And so a lot of the tools that we see for prevention online are not geared for people who need recovery. And it can make it really frustrating for people in recovery who say, okay, I tried to eat really well this week, but I was too tired to make dinner. And on Friday, I had to order the pizza because I just didn't have it in me to do that. Or I lay down to meditate or sit down to meditate in the morning and I can't get my brain to shut up and I don't know what to do about it. And then there's nothing else there for them as far as recovery tools. So that is something that I have learned and that my colleagues have learned kind of through trial and error, in our own experiences and in researching what is better for a brain and a body that doesn't necessarily have the resources to engage with preventative tools.
So, what would be a great, so say, what would you tell the person who says, I have a hard time distinguishing, say, that this situation where I don't have it in me, and how do you distinguish that from somebody who maybe is not moving in the speed at which they could, but that they had the realistic means to do so, to take actionable steps? How do you distinguish the two from someone who has legit symptoms and maybe someone who maybe is coddling comfort zone?
Absolutely. That's a really good point. If you have energy after you work out, if it does what it's supposed to and it makes you feel better, even if you don't like the process, you've probably got enough energy to do that. And that may be a point where you're just kind of sitting on your hands a little bit out of comfort. If you go to do a workout, even if it's a mild workout like yin yoga or something very low impact, and you're tired afterward and you feel like you need a nap or you're more prone to injury when you didn't used to be, that can be a sign that your body doesn't have the resources necessary to support that kind of energetic output.
And I love that distinction, because I think that I can only imagine that as people delve into this area, that it would become a little bit harder to separate the two, or maybe to be told, well, you're just being lazy. You're just, oh, just hop to it. Just one, two, three and go. And have you dealt with that before, that people just have, trying to make clarity of that this in fact is burnout and not lazy?
Yeah, absolutely. And that's something that I actually had to do with my own doctor because they were saying, "How much exercise do you get?" And I said, "I'm too tired." And they said, "Well, you'll get more energy the more you exercise. It'll be this positive feedback loop." And it wasn't. And I was like, "Who is lying to me right now?" I feel like the whole system is lying to me. And so one of the things that I do with some of my clients, especially when they're in the recovery process, is as you start to feel better, there is this impetus to go 2 feet in and go back to what you were doing before, and that can still be very exhausting. So it is a little bit of like a mess around and find out situation where, okay, I did a really good workout yesterday and that gave me energy, and then I did another one today and it was too much. So tomorrow I'm going to back up. I'm actually not going to work out tomorrow and I'm just going to rest, and then I'll see how I'll feel the day after that. Maybe I can do something light. And so it's really, again, getting back into your body and recognizing the signals of what your body tells you it can do versus what your brain is telling you do or don't want to do.
That's a very powerful point. We're going to take a commercial break. We'll be right back here on The Health Revolution.
Coming this spring, by popular demand, the second season show on the Tour of Love.
The E360 TV platform is saying we want the Tour of Love.
With winner of the first Global Impactor Award, Tamara Hunter, along with Emmy-winning co-host Skip Thomas.
We are going on tour, on the road. It's time. Love unites, and there is healing through connections. This is a worldwide movement, the Tour of Love.
We're back here on the Health Revolution. We're so glad that you can join us today. I'm your host, Adriana Morrison, spending some much quality time with Dr. Eliza Collins. She is professionally known as the Burnout Witch. She's a psychedelic facilitator and burnout expert. And so we've talked a little bit, well, let me back up. We've talked in great detail about burnout, burnout prevention, burnout recovery. Now I want to switch gears a little bit and talk about the legalities behind all that surrounds psychedelic therapy. And for someone like me, of course, I'm thinking back to the 60s and things and all of that and the elements that have come to represent that time. But let's see if we can unpack some of this. Talk about how you became a psychedelic facilitator. And then I want to talk about the navigation, like what the paths that you take for psychedelic therapy for it to be legal and a viable option for those who would benefit.
Yeah, absolutely. So there's a lot to unpack here. So for me, part of how I got into psychedelics was utilizing them for my health benefits, for the health benefits of kind of reconnecting that brain and body connection that I had felt had been impacted by my childhood trauma. So I found a coach, like I said, and I spent about 5 months preparing for the experience, and then had the experience, integrated that. That's the other piece of that with psychedelics that's really important. And then through the process of utilizing it for for microdosing, I have a bachelor's degree in chemistry as well. So between my background in Eastern medicine, biomedicine, and my background in chemistry, I was sort of uniquely positioned to understand both the science and integration elements of this type of work. And there's not a lot out there for microdosing, which is what I specialize in with my practice. So that was me kind of navigating that myself and figuring that out and figuring out best practices from some organizations like MAPS, which is the Multidisciplinary Association of Psychedelic Studies. They've really set the foundation and laid the cornerstone for what good psychedelic work is. So that's what I adhere to in my psychedelic work with other individuals, is making sure that I'm adhering to their framework, because it is centrally focused around what we call harm reduction. So anytime you're engaging with any substance, and this kind of goes for any kind of intervention, whether it's talk therapy or surgery or medication or psychedelics, there's always risk associated with it. So what do we do to make sure that the risk is absolutely as small as possible and that the person is as safe as possible while engaging with whatever it is? If it's surgery, you're going to a trained surgeon. If it's medication, you're making sure that their medication doesn't interact with other things. If it's psychedelics, it's making sure that somebody has the emotional resources and tools and techniques to navigate that space, which is why that preparation part of it is really, really important. From a legality standpoint, that is a much more multifaceted process right now, because it's kind of at the liberty of each state in the United States. And I speak for my own experience as somebody in the United States. It's obviously different throughout the world. Various states are decriminalizing or legalizing, and those two are slightly different. So if it's legal, it's just legal, it's out there. Decriminalization means that there's not a focus on it as a substance. Police aren't going to make it a priority. They're not really going to prosecute it. There might be a light fine for it if you're caught with it, or you're caught with an amount that is in excess of what you would be allowed to have based on the regulations, the local regulations. That varies from state to state. So we've seen a lot of movement in places like Oregon and Colorado. We've seen some movement in places like Massachusetts and where I am in Rhode Island. And then other states really haven't addressed it quite yet. But there is bipartisan support for it, which I find really interesting, because it seems to be one of the handful of things that we can agree on both sides of the aisle right now in the US, which is very exciting. And there's a lot of movement in states with legislation to get that ball rolling, to give people more access.
This is huge. This is fascinating to me. Let's talk a little bit about what microdosing is. You talked about it, you touched on it, and I'd like for our viewers to get a clear understanding of what that means and how you implement that with the practice that you do.
Absolutely. So when we think of psychedelics sort of traditionally, like you had mentioned back in the 60s, we think about the big trip, the big LSD acid trip, or the big mushroom trip where you hallucinate things and you see pretty colors and, you feel this great big sense of oneness with the universe. That amount, and everybody's tolerance is a little bit different, but that's generally considered to be about 1 gram to 5 grams of psychedelic mushrooms. And psychedelic mushrooms are my area of specialty. I don't muck around with LSD and ayahuasca and all of that. I like to stay in my lane with psychedelic mushrooms. A microdose is a significantly lower dose of that. So it's what we call subhallucinogenic. So when you take it, you might feel something kind of the way that you would take like an antidepressant or something like that. If you have a medication for panic attacks, you take that, you feel it in your system, but you're not hallucinating things. You're not sort of outside of yourself. So it's not subperceptual, but it is subhallucinogenic. And that amount, if we think of kind of 1 gram as the bottom of the dosing ladder for psychedelics from a large dose trip perspective, like 0.05 to 0.1 grams is what we're taking. So if you think of like a venti coffee, this is like a thimble. So it's really, 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 really small. And what we do with microdosing is usually people do that on what we call a microdosing schedule. So you would take it a couple times a week for 4 to 8 weeks, as opposed to taking one large trip in one sitting.
So how is it constructed, the dosing piece? Like what elements are considered? Because I'm assuming that this would be, individual results do vary. And so then what are elements that you consider to put someone on a schedule, a microdosing schedule? What are some essential components that you put into place to keep those risks where they as low as possible?
Absolutely. This is one of my favorite things to talk about because I think we tend to not talk about it. Everybody gets really excited about the possibility of what psychedelics can do. And there's not as much conversation around the harm reduction and the safety piece of it. So one of the primary things for me, and I'm also going to differentiate between coaching and therapy. Psychedelic coaching is not the same thing as psychedelic therapy. So if somebody has unaddressed trauma, they have a trauma history, they know they have a trauma history, or they've got all of this stuff and they're not sure if they have a trauma history because they don't have very clear memories of it, that's not the time that you would want to go diving into psychedelics. Psychedelics tend to amplify whatever we're feeling, and they may bring up stuff that we're not even really conscious of. So for me, I had spent many, 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 many years addressing my trauma. I was very familiar with it. We were old friends. So that was something that I felt like I had dealt with enough and understood enough about to be able to engage with a psychedelic. If you haven't done that work, I highly recommend therapy first. And you can do that with a regular therapist, or you can do it with a psychedelic assisted therapist in preparation for psychedelic therapy. But that's not something that psychedelics aren't something you want to go diving into if you haven't done that internal work. One of the other things that we want to be careful of is if you or someone close to you has a history of what we call psychosis or psychotic episodes. So if you have experienced hearing voices, if you've experienced some sort of psychotic break, if a parent, an aunt, an uncle, a sibling, even a grandparent has experienced that, psychedelics may not be the best thing for you right now. We don't have a lot of research in that area, so I'm not saying that people with that type of background could never engage in it, but we don't know enough about it from a medical standpoint, so that's not the first place that we would go. And then lastly, we want to be very careful with medications. So these substances can interact with certain types of medications, antidepressants, specifically SSRIs and MAOIs. And if somebody has a cardiac issue, if they've got some other underlying health conditions that require them to be on medications, we want to be very careful about allowing them to utilize that without knowing how it might interact with it.
And this is huge. I love how you are being very careful and very clear in the messaging. And what I'm getting from this is that there is a benefit to having a sense of connection to yourself, or at least a willingness to be like, okay, I'm ready to do my work. So it's not just clearly it doesn't present as a quick fix, but that's one thing that I'm getting out of all of what you're sharing with us today. And I'm curious to see with what kinds of objections do those who consider this as an option for therapy, like say they've been in therapy, say a person's considering microdosing, and then maybe they're taking some medications right now, but then say someone within that space, a healthcare provider, is giving a little pushback with concerns that they might have. How do they approach having that careful conversation?
I think that one of the best ways that we can do that is to create a community for providers to talk to each other and understand more about it. Because if somebody comes to me and says, I'm on an SSRI and I want to take a psychedelic, I'm not going to be the person to tell them to go off of their medication. I'm not going to be the person that is going to help them wean off of the medication. The person who needs to do that is the person who prescribed it, or the therapist or psychiatrist that they're working with. And that has to be a conversation where that provider is included, because they may have concerns about that person coming off the medication. So it needs to be a supported kind of holistic, and I don't use that as like alternative, but truly three-dimensional conversation between all of the healthcare providers. And so I'll usually have my clients sign a waiver that says I can talk to their healthcare providers, and they acknowledge that they communicate with their healthcare providers, because it's really not a good idea to be kind of engaging in this type of work behind somebody else's back who's also trying to help you. And has stake in the game in terms of saying, I put this person on this medication. So it's really important to have very open, honest conversations within the medical community about it.
I love this disclaimer. So what happens if someone doesn't live in a state like yours or mine? I'm here in Colorado.
Right.
What if they don't live in a state that is a little more further down the line in terms of decriminalization and acts to get closer to this being something that's more viable, more available? But then maybe they check off all the points that this would be a realistic option for them to address some of the issues that they have. What should they do?
So in some places, like in Rhode Island, it's not fully decriminalized yet. There's legislation in that direction. But what we do have is something called ketamine therapy. So somebody in Rhode Island wouldn't necessarily be able to work with me, but they would be able to work with a psychedelic assisted therapist who does ketamine therapy. And I know some of those people because I also refer to them if I have people who come to work with me. One of the things that got me into this space is that I knew people in the community who know my background, and they said, hey, I've got, this amount of mushrooms and I'd like to utilize it, but I don't know how. Can you help me do that? I'm not providing it to that person. I would never, that's illegal, but people tend to get their hands on things anyway. I feel like that's kind of always been the case. If people want things, they go out and find it. And so that's sort of how I got into doing what I do, because I'm not providing it to people, but I have the skills to help them say, okay, if you're going to do this anyway, I still want you to be safe. So that's why my approach centers around harm reduction. And I usually encourage people who decide to go out and get this for themselves, which I don't encourage doing that. But for the people who do, I encourage you to get those substances tested. You can get a home safety test to make sure that it's not mixed with anything or adulterated with anything that could cause you significant harm. That's one of the things that we see, not so much with psychedelics around here in terms of like mushrooms, but with other substances. It's been a real problem with things like fentanyl and people having these really terrible overdoses because they didn't realize that it was in it. So again, safety is paramount. So if you're in an area where these things aren't decriminalized or legalized, you can check to see if there are therapeutic options. There are sometimes research studies. That can be one way that people can get into this. If they're doing a research study in your area, I think there was one recently in Connecticut on migraines, psychedelics and migraines for people who met that criteria. So you can go online and look for research studies that you might be able to sign up for, or if you live in a neighboring state. I know California, I think it's decriminalized. And so if you've got the means to travel, that's something else that you can do.
Now, does the traveling piece, does that add that? I'm assuming that probably adds a unique layer of a situation happening. Like if you travel to or let me back up. If a person travels to a decriminalized state to go ahead and obtain, then what are the scenarios that they need to be aware of if they travel to a state and maybe that they're going back to their state that doesn't have decriminalization?
You need to be mindful of that. If it's illegal in your state, it's illegal in your state, and it's illegal to bring it to your state. And this was the case with cannabis in Colorado as well. So cannabis was Colorado was one of the first places to decriminalize and legalize cannabis. And so a lot of people wanted to go there and buy a bunch of stuff and ship it back in the mail or try and sneak it into their carry-on or their luggage, and that's still not legal. So if you are going to go to a decriminalized state to utilize this, you want to, again, make sure that you have a safe place to do that you have somebody with you who is supporting you. We talk about set and setting in psychedelics all the time. You want to have a good mindset and you want to be in a good setting, a safe place. And you got to leave it there. Whatever you get, you don't necessarily get to bring back with you, because taking that across state lines is usually a federal felony, and shipping it as well.
Yes. And so what does someone do if they don't have the support, but they're very clear on these are the steps that they are open to trying, that they've committed to trying, but then no one around them is supportive? Then what happens next, or what should be the likely course of action next?
So you can go online and you can find a psychedelic specialist. Definitely look into their background. Ask them what type of modalities and regulations they adhere to. Like myself, I follow the MAPS protocols because I think that's the best. see what kind of background they have. You can work with people online. And if you've already decided to do it and you're in a circumstance where you're feeling overwhelmed, there are really great organizations like the Fireside Project who provide helplines for people who may be having a psychedelic crisis moment, if they're having what we call a bad trip. Even after the fact, if you've come down from your trip, if you're days or weeks out, they will also talk to you from an integration perspective. So there are places out there that you can get that support if nobody around you supports you, but I still would recommend that you go to a medical professional and let somebody in your healthcare circle know that this is something that you're interested in doing or that you plan on pursuing.
These are incredible recommendations. We will be right back after this commercial break. Stay tuned.
Life is so fragile, and we're constantly reminded just how fragile life can be, especially when we or a loved one is told we have cancer. Cancer survivor myself, I can tell you, we still feel very alone in this journey.
There's a study that's been shown that patients who are socially isolated have a worse prognosis, have a worse outcome than patients who are socially interconnected.
Buddies for Life is a non-profit cancer support group for those whose life has been impacted by cancer. Humor, hope, heart, and hugs.
Humor, hope, heart, hugs, and a whole lot of love.
Share this with your friends and family and support this community in every way you can. No one should face cancer alone.
I am a chemo buddy for life.
We are a buddies network.
No one does cancer alone.
Be a buddy.
And we are all here for you as a community of love.
We are chemo buddies for life.
And if you've heard 3 words, you have cancer, for yourself or someone else, you belong with us at Chemo Buddies for Life.
Healing through connections.
We're back here on the Health Revolution. I'm your host, Adriana Morrison. And no matter how you're tuning in right now, don't forget to hit the subscribe button. We certainly welcome your input and your feedback in terms of how each show stands alone and all of the interesting takeaways that we have. We have been spending some quality time with Dr. Eliza Collins, a psychedelic facilitator and burnout expert, professionally known as the Burnout Witch. So we talked about some of the parameters that must be taken into consideration, not should, but must, when it comes to those legal pathways to psychedelic therapy. What's the consensus right now in terms of the laws? What's the latest news with this being just where it stands today?
Again, that's really variable depending on where you're located. So one of the things that I really like is a website called Psychedelic Spotlight, and they have a living list of where those legalities are changing, and it's constantly being updated. So I think in Colorado, they were looking at like full legalization. There are a couple of places where it's sort of legalized medically, but not recreationally. In Massachusetts, it's not legalized in the state or decriminalized in the state, but there are various municipalities like Cambridge and Salem that have decriminalized it and changed the priority level for it. So the best place to get that is really psychedelicspotlight.com. And I'm not affiliated with them in any way, shape, or form, but they do have the best and most up-to-date information about where that's happening, as well as other really effective tools to understand the psychedelic landscape.
What are some of the best ways to look at both Eastern and Western approaches? So this is more of a roundabout question that I have for you, because I know that your background is, East meets West, and how, in what ways does this help to integrate the best of the best for both worlds versus like one over the other? How are the different ways that you integrate the two with your approach to working with others?
I have a lot of respect for the indigenous cultures who have utilized this in the past and who still utilize this as a part of their culture. And I think that that's something that's not brought into the sort of medicalized approach to psychedelics. And so I think that there's a really valuable conversation to be had that really folds in the indigenous heritage and wisdom with how we use these types of approaches, because they're often done in ceremony. They're often very supported. There are ways that they have been going about this for centuries and millennia that are really effective and really fantastic. So I would love to see that dialogue more. And that's something that I very much keep in mind when working with my clients, as somebody who is non-Indigenous, but who has a great deal of respect for the intentionality and wisdom with the way that they utilize these substances.
When you've spoken with physicians before, and those of, like, say, MD status background, what has been their biggest concerns that maybe contributes to societal pushback for this not being further along in terms of like legal ways to psychedelic therapy and all of that?
It's funny, I actually don't see a lot of pushback from the medical community because
Okay.
they're very invested in working with individuals in a much more three-dimensional way and giving them more options. And the research is so extraordinarily, overwhelmingly supportive of how effective this type of work is. So I'm not seeing a whole lot of pushback from the medical community. But again, I have the bias of talking to the people that I talk to who tend to think similarly to me. It seems to sort of be more around a safety issue and a regulation issue. And I know that that's been a problem with the cannabis industry as well.
And I love this because at least this is getting very granular with how, some of the components to remember and to keep in mind. Where do you see things going in terms of what psychedelic therapy can do, based on your studies and based on your experience in working with people?
I really see it as being a much more integrated and accessible process for people to heal, again, everything from day-to-day stress and burnout to postpartum depression and PTSD. There are a lot of places that these things can be applied, not as the cure-all and not as a band-aid, but as one element of a bigger toolbox that can help people really properly heal whatever they're dealing with. And I think that there's so much overwhelming support for it from a medical perspective and even from a political perspective that I'm really hoping to see a substantial shift in the next 2 to 5 years, both at state and federal levels.
Are you seeing a whole lot of dialogue on the federal level? Is that it, or is there any news with that's on the horizon, or maybe rumblings or whispers of what might come at the federal level?
Not as much as I would like, but yes, there are people in Congress, particularly in the House, I think AOC, and then one of the representatives, the Republican representative from, I believe, Texas, just put forth legislation about that. And there is talk about it, but things happen so much more slowly at a federal level that I think it's easier right now for the federal government to sort of disperse it to the states. But I would love to see that. And again, I think most of this will probably happen in the next 2 to 5 years, just based on the momentum that it has.
What are your favorite ways to ensure safety for those who are really leaning in now and saying, wow, I never really thought about this before. I guess the possibilities are out there. What are your favorite safety parameters to make sure are in place for those who are embarking on psychedelic therapy?
Definitely. Again, be very, very careful about where you source. If you are getting it in a decriminalized place, be able to get it from some place that actually, makes it. If you're not, have that safety measure in place, get your substance tested. Again, I do not recommend getting this from a non-decriminalized place or through illicit means, but people going to do what people going to do. And have a buddy. If you've never done something like this, if somebody has experienced psychedelics, it can be really useful. If not, work with a specialist who can talk to that person about how they can support you. And this goes for microdosing as well, because you're still finding that sweet spot for yourself. So you want to make sure that you're not doing this alone. And preparation and integration are absolutely essential. So again, I hammer this home, but it's really important to work with an individual who understands these substances, who can talk to you about some of the emotional things that may come up for you, and who can give you tools, breathing exercises, movement exercises, mindfulness techniques to help engage with that in a way that allows you to be present with it instead of becoming anxious and running away from it. And ultimately, if it doesn't feel good to you, if you get to your day and you say, I'm going to do my microdose or I'm going to do my trip, and you're anxious and you're worried and you're not feeling good about it, do not do it. There is nothing wrong with opting out of that because it has to feel good and right and safe for you.
So for those who still consider this, maybe for those people who are grappling with it, feeling like it's a taboo subject, what are some dialogue samples that you could give to those, or any viewers that are watching that would like to delve into the conversation, like to initiate the conversation, but don't know how to say it, maybe are afraid to be, to land the message home, to make it just to share that this is something they want to do without being without getting this flack, because some feel like it's a taboo subject?
Yeah, so I'm a big science geek, so I always go back to the research, right? There is so much overwhelming research, particularly on the safety of specifically psilocybin mushrooms. When I testified at the Rhode Island State House in favor of the House bill that did get passed this past June, I think, one of the studies that I cited is that it is actually has a better safety profile than Tylenol. So being able to cite research on the safety and cite research on the efficacy, particularly if what you want to utilize psychedelics for is something that has been studied. So they've done studies on PTSD, anxiety, depression, treatment-resistant anxiety and depression. There was a study that just came out in the last couple of months, a very small sample size, I think it was 10 people in it, but on anorexia, psychedelics for treating anorexia nervosa and the underlying emotional component of that condition. So dig into the research a little bit. You can go on a website called PubMed, PubMed.com, and it's a search engine, and you can look for research and just look up psychedelic research or psychedelics and migraines or psychedelics and anxiety. And being able to support your point with science is always really useful.
I love that. Absolutely love that. We'll be right back after this quick commercial break.
Jeff Pearson here, host of Invisible Condition, where we talk about all the people who are living and thriving with all those conditions that you can't necessarily see from the outside. Join me every Tuesday and Friday at 10 a.m. Mountain Time on E360 TV.
We're back here on the Health Revolution, spending some incredible time with Dr. Eliza Collins, psychedelic facilitator, burnout expert, professionally known as the Burnout Witch. Where can people find you as we are all leaning into just with all how you've eloquently explained the path to being handling burnout, and then also the legal uses of psychedelic therapy?
I'm mostly active on Instagram, and I really love interacting with people. So my handle is the Burnout Witch, and you can find me on there. I'm on TikTok less so. I'm also on LinkedIn, and you can also just go to my website, www.theburnoutwitch.com, and poke around there and see what information you can find. If you have questions, please feel free to reach out. I love questions. I love educating people, and I love connecting with people.
Do you have anything coming up on the horizon as we round out this year going into 2024?
I do. I recently finished an ebook that's going to be available on my website on the structure of microdosing. It's a guide to an introduction to microdosing. And then I have a group and individual program that's broken up into segments. So the first 4 weeks of it is an educational program for all of the information about how to start microdosing, techniques that you can use, information that you need to create a good environment for yourself. It's largely the framework of what I do with my clients. So that's a 4-week program. And then you can add on to that a 4-week individual or group coaching program that actually supports you with my support through a microdosing protocol, through a microdosing sequence. And it's called Breaking Through the Architecture of Conscious Microdosing. And the program launches September 11th. So we're coming right up on that. So the 4-week educational program starts then. And it is a program that I will be rolling out throughout the year as well. So I may open up an October cohort for that. And then the next one will probably be after the first of the year, just because if people want to do coaching, that's a lot to do around the holidays. If you're dealing with holiday stress, that's definitely not something that we want to do at the same time that we're doing psychedelics.
That's true. And I love that. So for viewers who are leaning in and taking notes, that obviously all of her information updated will be on her website, theburnoutwitch.com, and that'll be updated in real time. So no matter if you're tuning in on live or on demand replay at any point in time, that's where you're able to access that information. So Dr. Eliza Collins, the Burnout Witch, thank you so much for spending time with us today. This was incredible, and it flew by fast.
Oh, this is fantastic. Thank you so much. I really appreciate the opportunity to talk about psychedelics and burnout in such an open and comprehensive way.
Yes, and we wholeheartedly back that up, being able to have the right conversations. And for those of you who are tuning into our show, maybe you're newer to us, don't forget to check out the information that we provide. It is on our website, and that is thehealthrevolutiontv.com. And that's a place where you can also sign up for you can subscribe to our newsletter. You can share show ideas, maybe show topics and input, things that you'd like to see, information that you'd like for us to tap into. And don't forget that you can always find us here on the Achieve TV channel on E360 TV Tuesdays and Thursdays, 10 a.m. Pacific, 1 p.m. Eastern Standard Time. We appreciate you. And of course, that's all the time that we have. So have an amazing rest of the day, no matter where you are. And until next time, take care. We'll see you soon.